Hello everybody, I am Dr. Santosh Kumar, orthopedic surgeon based in Kolkata, and I head the Purva International Orthopedic Foundation, a foundation which is designed and determined to bring the world-class orthopedic surgery right here in Kolkata in front of you. What we are going to talk today is about what is known as ACL reconstruction. ACL means anterior cruciate ligament. Now the knee joint is a huge joint, it's a big joint with two internal ligaments which are known as ACL and PCL. Now this is knee joint. If you remove the kneecap or patella and if you bend the knees, you will see there is a ligament which goes from front to behind. This is known as the anterior cruciate ligament, and there is a ligament which goes from behind to front. This is known as posterior cruciate ligament. These ligaments cross each other, that's why they are known as cruciate ligament. Now this anterior cruciate ligament can be injured in various ways. The most common ways of anterior cruciate ligament injuries include contact sports like football, hockey, basketball. It also includes motorcycle accidents, and in elderlies it includes going inside the sea and a sea wave breaks the anterior cruciate ligament. The symptoms and sign of this anterior cruciate ligament is hemarthrosis and instability. The word hemarthrosis means the knee joint is intensely swollen and it's filled with blood, and there is instability once a person tries to walk. Now this instability can damage further structures inside the knee joint, and this instability has to be treated by anterior cruciate ligament reconstruction. Now first, to see anterior cruciate ligament injuries, we have to do what is known as MRI or magnetic resonance imaging. In MRI we can clearly see whether ACL, anterior cruciate ligament, or both ACL and PCL, that is anterior and posterior cruciate ligament, both of them are injured, and along with that we can also see if the washer shaped cartilage, which is known as meniscus, is injured or is intact. After establishing clearly which ligaments are injured, we go for arthroscopy. Now in arthroscopy we make two keyholes and we enter the joint through a 4 mm telescope. We see inside what is injured inside and all the ligaments inside the knee in a big TV screen. Through another portal we take the instrument inside the knee and we reconstruct the anterior cruciate ligament. Now this anterior cruciate ligament cannot be repaired, it has to be reconstructed. That means a new ligament has to be put in there. This graft is taken from our own knee, what is known as semitendinosus muscle. Now this semitendinosus muscle lies posteriorly in the knee joint, somewhat around here, and this is a tendinous muscle. We take this muscle and we make quadruple stranded graft which we put inside the knee. We make a tunnel in the tibia and in a femur. We pass the graft through that in a very properly positioned way, and we fix with something known as interference screws. These interference screws are biodegradable screws and they go away with time, and we start rehabilitation exercises and movement from the very next day of surgery. Normally people are able to start walking independently without any support by 2 to 3 weeks. Jogging starts by around 1.5 to 2 months, and competitive sports starts by 4 to 6 months after this surgery. Majority of the people whom we have operated, professional players, they have gone back to sports, they have gone back to football or hockey, and they have been playing football and hockey after this cruciate ligament surgery. Now this cruciate ligament surgery is important in order to prevent degenerative joint disease. If we do not do this anterior cruciate ligament surgery, there is chance that the joint becomes unstable, and this micro trauma created because of micro instability degenerates the joint and leads to accelerated osteoarthritis. So it's important that we reconstruct this ligament through arthroscopic surgery.